Hi, my name is Zoe Wright, and my presentation will be about lupus. Before I get into the presentation, I want to talk about why I chose lupus. Lupus interests me because in one of my favorite shows, House MD, a popular medical TV show, it was one of the first diagnoses, but immediately ruled out because of the symptoms and cause of the patient's illness. I wanted to know how lupus is properly diagnosed and why it can get confused for other diseases. Lupus is an autoimmune disease that causes inflammation in the body and attacks the immune system, as defined by Adani Mashahan in his journal about understanding lupus and how severe it can get. Systemic lupus erythematosus, or SLE for short, is an autoimmune disease characterized by autoantibody production and deposition of immune complexes with completed activation, resulting in inflammation and damage within the affected tissue. Many common symptoms of lupus overlap with other diseases, such as rheumatoid arthritis and some tissue diseases. The common symptoms of lupus are fatigue, rash across the face, which is pictured on the right, skin lesions, shortness of breath, chest pain, dry eyes, and/or headaches, confusion, or memory loss. The symptom that is consistent with every case of lupus is a butterfly rash across the face. The malar rash is the most identifiable acute lesion, marked by erythema, and elevation is a butterfly distribution that spares the nasolabial folds. Some causes of lupus can be sunlight. Sunlight may cause skin lesions like the butterfly-shaped rash across the face, or an internal response of the immune system. Infections. Infections can cause lupus to initiate or cause a relapse of lupus. And medication. Certain blood pressure drugs, anti-seizure drugs, or antibiotics can trigger lupus. Usually people with drug-induced lupus get better when they stop taking the medicine that caused the disease. Environmental triggers such as exposure to ultraviolet radiation and infection or the use of certain medications such as echinacea, sulfonamide antibiotics, minocycline, and anti-TNF biologics should be identified if possible. Lupus affects the skin, joints, lungs, and internal organs like the kidneys and heart. Lupus causes the skin to have lesions and rashes, either brought on by sunlight or genes. They are classified in 3 different groups: acute, subacute, and chronic. For the joints, arthritis and arthralgia are the most common presenting manifestations of SLE. Mainly the joints in hands and wrists are affected, sometimes the knees. Lupus also affects the brain, causing headaches, depression, confusion, and/or memory loss. The life expectancy for lupus is around 80 to 90% unless there's a significant organ damage to the kidneys, lungs, and heart. Women are more likely to see a better outcome after being diagnosed with lupus than men are. SLE is more prevalent in the female population, but its course is more critical and expeditious in men, which culminates in a bad prognosis. The complex and protean nature of SLE demands a meticulously derived history, thorough physical examination, and appropriate laboratory analysis. Diagnosing lupus can be difficult because signs and symptoms are different for each case. There must be multiple tests to confirm the presence of lupus and get a proper diagnosis. Some of the tests include a complete blood count, which tests the amount of red and white blood cells, urinalysis, anti-nuclear antibody tests. Physical examinations for lupus are chest x-rays and echocardiograms. Treatment and control. While there is no cure for lupus, there are some treatment options to control lupus from being fatal. The main goals of treating lupus are maintaining lowest degree of activity using immunomodulators, preventing organ damage from active lupus, and reducing comorbidities secondary to lupus and its treatment. Medication to control lupus are immunosuppressives, antimalarials, steroids, and biologics. Disparities. Women are vastly more affected by lupus than men. In women between the ages of 15 and 44 years old, the female to male ratio is up to 13 to 1, while it is only 2 to 1 in children and in the elderly. While it is more common in women, men can contract lupus and can be harder for men to get diagnoses, leading to some men not being able to get a proper lupus diagnosis. Lupus is more common in minority groups like African Americans, Hispanic Americans, Asian Americans. Some say it could be due to certain genes and not enough health care for minority groups. It primarily affects young women, particularly women of color, and is up to 3 times more prevalent in historically underrepresented groups. The graph on the right displays the mortality rates between lupus cases among black and white people, and then the overall cases of lupus. The black population see more mortalities from the time of their diagnosis and on. Conclusion. I found that lupus can be confused for other diseases such as rheumatoid arthritis, but with the right tests and examinations, lupus can be properly diagnosed and treated. Learning the disparities not just between races but also between sexes was very interesting. The difference between recovery outcomes for men versus women was very surprising and opens discussion about genes and how different diseases only majorly affect one population. Since it is an autoimmune disease, it is harder to cure the disease, like HIV or AIDS. But there are a lot of different treatment options to control and reduce the effects of lupus for someone to live a long and healthy life. As we progress as a society, there will be more advances in medicine, and I believe we'll be able to cure people that have autoimmune diseases. Thank you so much for listening, and I hope you learned something new.